I'd like to tell you about a friend of mine, Chris. Last September, Chris fell 50 metres down the Matterhorn in the Alps. One of the traumatic injuries Chris suffered was a severely fractured leg. Every year there are 16,000 people globally who, just like Chris, undergo complex limb reconstruction, half of which happen in the US. Following surgery, these patients must attend a specialist fracture clinic every 2 weeks. Recovery time is long, for some over a year. In the US alone, these specialist consultations cost more than $100 million a year. Clinic visits involve adjusting a frame around the person's limb which provides stability to the fracture. During each consultation, the patient has a series of x-rays followed by a physical assessment by a specialist consultant. This assessment is subjective as it relies on the experience of the consultant to interpret an x-ray with little clarity. Due to the subjective nature of these assessments, the length of treatment is prolonged to ensure complete healing. This unnecessary extended treatment is not only at a huge cost to the healthcare provider, but also has a significant impact on the patient's physical and mental health. This is where we can help. We have created a device that can accurately and objectively determine the progression of bone healing. By improving the monitoring process of these complex fractures, we can reduce the number of outpatient consultations by at least a half. In 1 year, with £250,000, we can take a device from a basic concept to a clinical-ready device. Beyond this, with £2 million, we can bring our device through clinical trials and regulatory approval in the EU and US. My name is James Scott, and I want to improve the recovery process for patients like my friend Chris. Thank you.